All right. Well, welcome everybody. Good afternoon. It's Barry Sarvet again. And if we haven't met, I'm the medical director for MCPAP, and we're really pleased to have our clinical conversation today. And it's really nice. I think this is a really good topic, for us because it's so practical and it really comes up, for so many of the kids that we take care of. And you'll hear more about what it is. But in any case, please just keep in mind that we are on the fourth Tuesday of each month, and next month is the 26th of May. And the speaker that we have for that topic is not finalized at this point. We'll be getting back to you about sort of who the actual speaker is going to be. But we do know the topic, and it's going to be about sexually reactive behaviors in children, particularly children who have experienced trauma, because we often talk about sexual abuse and trauma from the victim perspective. And there's lots of kids, who are sort of on the other side of this, who come up, in our practice and who often have their own history of trauma. And we'll be talking a little bit about how to approach, the assessment and management of problematic sexual behaviors for children. In any case, we're going to talk today about special ed services, particularly for students with disabilities and particularly mental health disabilities. Primary care providers have such an important role in advocating and trying to support sort of kids getting good special education services and things like that. And we have a really nice expert who's going to share with us all kinds of information about that. So I'll introduce her in a moment, but just in terms of housekeeping, as always, we have CME credit available. And so you see the instructions on the slide for requesting CME credit. And the code is LUGYOM, and that's through Mass General. And I think Parveen is going to put that in the chat as well in case people didn't have a chance to write it down. So we are going to record the session as usual, and the slides will also be made available on the website. And we're going to, as always, try to field any questions that come up, and hopefully we'll have a nice, robust conversation today about this. If you have a question, just type it into the chat or the question function in the interface, and we'll kind of make sure that we try to get to it before the end. And if it's relevant to what the speaker is talking about at the moment, we'll sort of introduce the question. We'll try to kind of slip it in there. So our presenter today, we're really proud to have Barbara Weichert. And Barbara Weichert is the educational specialist in a program called Advocating Success for Kids, which is part of Boston Children's Hospital. Prior to working at Children's, she taught in a classroom of children with moderate to severe disabilities in DC. It was an inclusion second grade classroom in Cambridge, and in a classroom for students with severe behavioral difficulties in Needham. So lots of experience of working with kids with mental health disabilities in the educational setting. After receiving her master's in education in curriculum and instructional design in reading from Lesley University, Barbara worked as a reading specialist until the beginning of her job at Children's. And so with that, I'm going to turn it over to Barbara and look forward to some nice conversation today.
Hi, it's nice to see all of you guys. So I'm going to be talking kind of about like the best ways to help parents access the special education they may need for their students, as well as the different types of accommodations and modifications that people could ask for. So I am opening up my presentation. And hopefully you guys find it helpful. Please answer, feel free to ask any questions that you have. And I'm sorry, it's freezing on me. All right, so accessing education for children with disabilities. This is important because often parents may come to you with a variety of non-medical concerns, with school issues maybe being some of the more common. They might bring in, if their child is currently on an IEP, for you to look at or to give any advice. And there's a lot of information just within that IEP that can, inform you for medical care, for school suggestions. You guys might also be asked to write letters to advocate for school supports and or accommodations that the kiddos may need. So just a general background of special education. It started with IDEA, which is the law for individuals with disabilities, and it's a law ensuring that all children with disabilities receive the services that they need in order to access curriculum and stuff. It dictates how states and public agencies provide things such as early intervention, special education, related services, and it covers more than 6.5 million eligible infants, toddlers, children, and youth with disabilities. And what IDEA says that public schools are required to provide students the equal opportunity to access the general ed curriculum, and that accessing curriculum is often much more difficult for children with medical, learning, or emotional needs. So for this reason, protections are built into the system, requiring schools to respond to child's individual needs. There's federal law, Massachusetts law actually cuts the time frame shorter so that the schools are responding quicker than what the federal law states they must. So one of the first steps, if somebody comes to you saying, we're worried about my child, they're struggling, their anxiety may be making them miss class or have school refusal or something like that, they need to put the request in writing that they are requesting an evaluation. And once they send that in, whether it's to the principal or to the special education coordinator, they should receive a consent from the school within 5 school days that they need to sign. And that consent will list the different evaluations being done. If the child is not in school, the parents could just go to the district's like Department of Special Education, but in school, just go directly to the school to hand it in. So in terms of the assessments, they will assess whatever the parent writes that they want the child assessed in. So examples of that would be achievement testing, speech and language, assistive technology, physical therapy, occupational therapy, a cognitive achievement test, or a functional behavioral assessment, which is looking at their behavior in the classroom. So the educational assessment would be part standardized test, but it also includes a history of all their educational progress, where they've been in school, what their current performance in the classroom is. Other assessments, there's the home assessment, which would talk about any family history or home situation that might affect their learning. People conducting it can do a home visit if the family agrees to it. And, this might be really looking at any type of thing that at home could be affecting the child getting to school, completing homework, or any of those things. A health assessment is typically done by a child's pediatrician and just encompasses any physical health problem that might affect their student learning. The psychological assessment is how kids learn best, their learning capacity, and how they learn in relationship to developmental skills and everything.
Hey,
Some
Barbara.
districts, yes.
Yeah, hi. I was gonna just let you know a couple of questions that came in the chat. One related to what you're talking about is the issue of concerns about executive functioning deficits, and so we're wondering if that's something that pediatricians can specifically request for them to kind of look at that. And if so, would that be sort of part of the psychological assessment that would be sort of expected in the special education evaluation? Yeah.
It's not yes, it can be requested. The parent, they could fill out a form saying, I am requesting academic, psychological, and executive functioning testing for my child. Usually the psychological is tests like the WISC, which are looking at, verbal abilities, visual, spatial, fluid reasoning. And while some of that can show executive functioning difficulties, there's more in-depth ones that the schools can do to look at that.
Okay, thank you. And also, they were asking about this you might want to take at the end or now, but it's kind of your call on that whether or not sort of what we're talking about right now is relevant to private school students, or if sort of the special education sort of services and the evaluation, would be limited to kids who are in the public school system. Yeah.
Yeah, the short answer of that is private schools do not need to offer services. What can happen is the families can ask the public school of their town to evaluate the student. And if they qualify for services, it's the family's responsibility to get them to the public school. So if they qualify for 5 days a week of reading and half an hour of a social skills group, it's the family's obligation to get them to the school to get those if they want the services. Does that make
Right.
sense?
Yeah, absolutely.
Okay.
Absolutely. The other question that was listed had to do with how they are going to assess the mental health aspects of the needs, and I think this speaks to a broader issue about what's the kind of relationship between, what we do as, kind of members of the, part of the healthcare system, sort of to kind of integrate with this evaluation. Like what are the boundaries between, the sort of external evaluations of some of these questions and the ones that are kind of really included in the special education assessment that people are requesting from the schools? Yeah.
Um, I think, and I do a lot of consults with psychiatry here and behavioral health here over the students they're seeing. I think, some of that, like the health assessment, can absolutely bring up there are difficulties with anxiety or depression or, school refusal related to anything it could be. I think it's harder to bring up a a question of, borderline or something like that, um, which isn't something schools could necessarily diagnose anyway. But once the diagnoses are there. So like a parent can bring in a letter from a physician saying my child is diagnosed with this. Please do the rest of the assessments and we can have a meeting to
Yeah.
see if they qualify for an IEP.
I guess really the question is, and that's helpful, but I guess the other outstanding question that I have is, and I've struggled with this, being in the field for, decades, is sort of what is the boundary, between what the school is really responsible for assessing, in relation to mental health, versus what, the external, healthcare system is responsible for. Because I can send a letter saying, this is my take, on the child's mental health, needs. And then I'm just not always sure, how much the school is wanting or needing or, feels responsible for directly doing their own assessment of those questions versus just relying on my, recommendation, my assessment.
I find with mental health, there's a lot of relying on what comes in because there's no good standardized test for mental health stuff.
Yeah.
Schools can't make or take away a diagnosis, which I can show you guys when we get to like if special ed services are needed. So they have to look at the diagnoses that the student comes in with.
Right. Right. Okay. All right. Well,
Uh,
yeah. Oh, go ahead.
okay, no, that's all.
Oh, okay. But sorry for asking so many questions. I hope I didn't derail you, but
Nope, not at all.
yeah, it looks like there's a lot
Um,
of interest in this in the chat. Yeah, go ahead.
yeah. Um, so when the school does their assessments, sometimes the parents disagree with it, or sometimes the parents want a second opinion, and that's called an IEE, an independent educational evaluation. So the schools will pay for some of it or part of it. The payment policies vary by district, where they will identify this place or this place can test you. They work out a payment rate, but not all school districts will do that. And the important thing to remember is that all recommendations must be considered by the IEP team, but they don't necessarily have to be followed. They should read through the evaluation, they should read through the recommendations needed, but special ed determinations are made by the IEP team after considering both theirs and the outside evaluations information. So at the initial IEP meeting, the parent or guardian are given copies of all of the evaluations that have been done for the student. They should get these 48 hours before the IEP meeting so that they can read over it, they can share it with outside providers, they can have a chance to think of questions they might want to ask. And then the meeting begins with everybody introducing themselves and asking what the parents' concerns are for their child, which can be super overwhelming to parents when they're walking in, not knowing anybody, and there's 10 people sitting around the table. So the parents express their concerns, the evaluators share their reports, and then they give the parents an opportunity to ask questions. And that's about like they start going towards, does the student qualify for an IEP? So there's a couple general outcomes. A student could qualify for nothing, but get things like Title I services, reading to intervene, a lunch bunch for social skills, which are offered but just not formally documented. They could qualify for a 504 plan, which is if the child has a disability but is only requiring accommodations, that they don't need modifications, just accommodations to access the curriculum. or they could qualify for special education services and have an IEP written. So this is kind of the checklist of going through. The first question the IEP asks for is, does the student have one or more of the following types of disabilities? Autism, developmental delay, sensory, hearing, vision, or deafblind, neurological, emotional, communication, physical, specific learning disability, and health. And I would say for you guys, the most of the kiddos you're seeing, if they were qualifying, would either be under emotional or under health. Health and ADHD are two of the most difficult things to qualify for.
Mm.
I'm not sure why, other than it's very hard to qualify under those categories. The next question is, so if you answer yes, the child has a disability, the next question is the child making effective progress in school? So they, just having a disability isn't enough to be placed on an IEP. They also have to be not making effective progress compared to their peers in the classroom. So if they are not making effective progress, you go on to the next question. If they are making effective progress, they're not eligible for the IEP, but they might be eligible for a 504 plan. And then the next question is the lack of progress a result of their disability? Yes, you go on. No, might be eligible for a 504 plan. And this could be things like, we can't really tell if it's a result of the student's disability because they haven't, they've been absent 43 times this year. Or, if a student's diagnosed with a learning disability as their primary diagnosis, but they're getting anxiety due to their knowledge that they're not reading as well as their peers and they're shutting down, it becomes well, they're not accessing their services because they're shutting down. It's not a result of their disability. So sometimes you need to get like that second disability added in. So if it is a result of this disability, they qualify for special ed. Once a student is qualified for special ed, the school has 10 calendar days to write the IEP and send it to the parents. And the parents have 30 calendar days to respond. And it's important for parents and other people to, like, everything else is school days. This is the only thing that is calendar days. And the school days really stretch it out. So right now, if somebody requested an IEP eval today, which goes by school days, it wouldn't be done until June. But with the calendar days, it is. So once the parents get the IEP, they sign it and they can either accept the whole IEP, reject the whole IEP, or accept parts of it and reject the other parts. The parents can also reject the placement, so that if a school says we would like to place the student in a therapeutic classroom, the parents have the right to reject that. They can reject the absence of counseling or pull out reading or sensory stuff. And once the parents sign it, the services begin. Once parents reject it, another meeting should be held. And if they accept some and reject the others, what they accept should start right away, and a meeting should happen to discuss the rejected parts.
Hey, Barbara, couple of questions that came in. So one is about kids who are suspected to have autism, and sort of bringing this question forward, just to remind everybody that MCPAP, has resources now to be able to do standardized assessments for young children who are suspected of having an autism spectrum disorder. And so that's something that we can provide, and of course, the school, might, do their own assessment, or they might really be relying on, outside assessments. And I guess the question from Polly, Five Ashes, is that if is the school have any responsibility in this regard, I guess, in terms of ensuring that kids can receive, the assessment that can validate, services, or just, sort of, justify, the use of services for kids, with, who are suspected to have autism, or is that really something that the family, has to be responsible for kind of seeking, on their own from, through their pediatrician or through the community and that kind of thing. Yeah.
So the family would be responsible for getting the report diagnosing autism, since schools can't diagnose. In Boston, the schools will do an ABA assessment at school,
Mm,
and um, some kids can receive ABA at school. The suburbs don't offer that. They may consult with an ABA specialist, but they're not giving direct ABA services to
mm.
the students. That's unique to Boston.
Okay. Okay. But keep in mind, everybody should definitely keep in mind the MCPAP function is part of our early childhood services, a new branch of services that we offer. And the other question is just those, requesting an independent evaluation, going back to what you were talking about earlier, and knowing that the payment policies, are, variable in terms of how much funding is available from the school districts, for these things. And I guess the question was, what do you recommend parents do? I think if they know that their child needs it and they really want to advocate for it, but they can't afford it, and the school is saying that they don't want to pay for it because they don't have a budget for it. Is there any particular strategies that you recommend?
Um, some parents will pay for it and then file to get the school to reimburse them. I wouldn't necessarily recommend that because it could go either way. Lots of families put their kids on like a wait list for a developmental medicine clinic somewhere, but the waits are super long for that, but insurance covers it. So that's another option. They can also reject the school not offering an outside evaluation, which doesn't guarantee it, but they would come back to meet about the reason the school isn't willing to offer it.
Okay, thank you. Um, that's all for now, although there are some other
Okay,
questions we can take later. Okay.
sure. So what I kind of went over was like the initial review where it's decided if the students qualify for special ed. If they do qualify, every year a new IEP meeting is held for their annual review. During this, no testing is completed again, and everything is based off of progress reports, how teachers are reporting the students are doing in the classroom, if they feel like the goals that were written on their IEP are being met. Often school teams have a plan before the meeting starts that they've all kind of discussed so that they appear on the same page. Many times the services that the student has stay for 3 years because every 3 years the school is required to redo all the testing. So a lot of times they're like, well, if they're getting pull out math 3 days a week, we're just going to leave it. It's working, it's giving them what they need. They will also discuss whether the IEP goals have been met. If they haven't been met, there should be a discussion about increasing services. And then new goals should be discussed. Parents also have the right to request a meeting at any time if they put it in writing that they would like to reconvene the IEP team. That should happen within 10 school days. Um, the IEP recently changed this past year, and I think a lot of families are confused about it. So I just wanted to kind of throw up the changes. They're giving a lot more to family and students having their voice heard. And there's now a whole section on the IEP that starts with what does the student want? What does the family want? There's also much more transition planning for students who are starting to age out of public schools and may need help from DDS or another DMH or another agency. High schools now fill out a form that refers the kids there, and that's supposed to be an easier way for them to start getting services. And the IEP has what's called the PLAFs, and it's the present levels of academic achievement and functional performance. So there's 4 tables on an IEP. There's an academic one, there's a behavioral, social emotional one, a communication one, and then additional areas, which could be hearing, sensory information, executive functioning, any activities of daily living that the kids might have to do at school. And it's divided into 3 columns. So on the left is their current performance. And it might say something like, John is reading at a 3rd grade level. He is able to decode words with 80% accuracy. At times, John gets sensory overloaded, and this accuracy drops down to 20%. In the middle, it lists their strengths and interests. So like he enjoys reading nonfiction books or whatever. And then all the way to the right is the impact that that disability has in that area. So, John's sensory overload and anxiety often affect his ability to read, as he is unable to remain in his seat or whatever it may be. Some of the sections have specific questions that are checked off, like does the child use an AAC device? Does the child use Braille? Is it an autism specific thing as opposed to not? It then gets into accommodations and modifications. So accommodations are like changing the how of how school stuff is taught, and modifications is changing the what is taught. So the modifications change what the curriculum is. If they're behind in math and they need to go back to working on addition and subtraction facts while the rest of the class is working on finding the area and the perimeter, that would be a modification. The accommodation could be, well, the class is working on area and perimeter, the students are given a calculator so that they're learning the concept but not getting bogged down by how to do it. Other examples are extra time on tests, which is a wonderful accommodation for learning disabilities, for some emotional challenges, using assistive technology like a typewriter or a tablet, having visual prompts as well as instructions giving so that they're both seeing it and hearing it. The modifications is changing the work so that it's being taught at their level. Parents can get pretty nervous about IEP meetings, so we often kind of go over questions that they can ask. And the basic ones are, did my child meet all of their goals? If they didn't, which goals did they meet and which goals did they not meet? What are the teachers' areas of concern? And if they're being pulled out, how does that impact the rest of their school day. So if they're being pulled out for reading or speech or counseling or OT to deal with sensory issues, um, what are they missing? Because you don't want them missing art or music or some of the more socially interactive classes because they do need that social time as well. Parents can have all sorts of reactions to IEP meetings. Sometimes they feel that the only thing being said is negative about their child. Sometimes people use words that they don't understand. Like parents will hear a lot about FAPE, which is free appropriate public education. They'll hear a lot about LRE, which is the least restrictive environment. And they'll, say sentences such as like, well, the LRE to receive FAPE is this classroom, and parents don't really understand what that means. And what it's basically saying that in order to access the curriculum, we think this classroom or this type of classroom would be the best for the student. Oftentimes there's an interpreter there, and either the interpreter's not great or the interpreter, I think IEP meetings are very specific, and sometimes there are certain words that don't transfer to every language, and the interpreter is trying their best, but it's a little bit off. A lot of the times the parents don't understand what happened, or information will be different from the progress reports. So progress reports come home every time a report card goes home, and it just says how the student's doing in meeting the goals on their IEP. And so sometimes the progress reports will say, oh, they're doing great. And then the teacher in the meeting will say they're not doing as well. So we just, let parents know, ask lots of questions. There's never too many questions. And they're always welcome to bring the students' IEP into us or to their primary care doctor to review it with them before they sign it. We also, when we're writing letters to schools or when we're helping parents with meetings, we find there's certain important words to use, such as unable to access the curriculum, requires instead of would be helpful, specially designed instruction, below expected age grade cognitive level, lack of progress, and the IEP goal has not been met, which requires an intensification of services. Advocacy tools that you can do is, tell them to request a school evaluation, which can be requested every year if there's a new concern. I did forgot to say, if you're requesting a new evaluation, there has to be at least a year from the first to the second to make the standardized test part still valid. They can again request an independent evaluation. They can ask for somebody to go in and do a classroom observation. They can file for mediation with the Department of Elementary and Secondary Ed, or they can hire an attorney or an advocate to file for a hearing request with DESE. Mediation.
Hey, Barbara.
Yep. Yes.
If you could go back to the previous slide, I was hoping that we could talk a little bit more about to advocacy, particularly from the standpoint of the kind of primary care, provider.
Sure.
Particularly sort of what the role of the primary care provider can and should be in sort of helping parents to, really sort of be the squeaky wheel if that needs to be done, that
Yep.
kind of thing. And one person in the chat actually asked, just to clarify, because you were talking about how the parent has to put in a written request, for an assessment, if they want their child to be evaluated for special education. and one of the people in the chat was saying that they thought that they could just, write a letter and that that letter would serve as the request. But so I wonder if you could speak to that as well. Yeah.
Sure, it needs to come from the parent. Providers can write letters, the parents just then have to sign it. And so sometimes it will be like, we are writing this letter and both us and the parent will sign it. But
Okay.
the request needs to have the parent signature on it.
Okay. So yeah, so that's good. And so what about sort of other general kind of advocacy sorts of strategies, from the primary care, the role of the primary care system?
Right. So, like, primary care can certainly write a letter not requesting the evaluation, but explaining a student's diagnoses and listing any recommendations that they think would be helpful to the student. And,
Mm.
that can be things like shortened school day, so they're not there as much, or scheduled sensory breaks, or using a graphic organizer for writing, or making sure there are visual as well as oral directions giving, or chunking the directions into short, easy to understand ones. And that is something that the school would have to consider, because it's deemed an outside evaluation in that respect, that it's coming from a provider into the school.
Okay. One of the other, thank you. One of the other advocacy questions that was brought up in the chat was about, it's not uncommon, to hear from families that the parents are reporting that certain services that were supposed to be provided are not going on anymore because of staffing changes at the school and things like that. And wondering about sort of how we can kind of help the parents to advocate, for those services to be restored somehow. That's kind of something that comes up a lot, I think.
Yeah. So if the services are not being offered because, say, the speech therapist has left and they haven't hired a new one yet, the
Mm.
school should be keeping track of the number of hours that have been missed and offer what they call compensatory services, which is giving the students exactly the services that they missed. So if they were getting speech for 30 minutes a week and there was nobody there for 8 weeks, they would be owed 4 hours of extra speech. That can be added on so that maybe they're getting 45 minutes a week till it's made up. It can be offered after school. It was a big problem during COVID, and they were offering it like virtually and on Saturdays, which was really hard for families to access and very difficult for younger kids to do it. But they do have to make up what's missed.
Mm.
If the school is saying, well, you've made so much progress, we're going to take speech therapy away, the parents can sign on the IEP that they reject the absence of speech therapy or of pull out reading or ending the social skills group or whatever the services are. And that's called stay put rights. And they can't take it away until there's a new IEP signed agreeing to it. So if the parents are rejecting that, the kids stay put with the services that they were getting.
So what is the term for that? I missed the term that you used for when, the school is expected to continue the services until a new IEP evaluation is done.
It's rejecting, it can be phrased anyway, like rejecting the removal of speech, rejecting the
Okay.
absence of it. Um, there's like a
Yeah.
little form on the IEP that says, I accept the IEP, I reject the IEP, I accept in part and reject in part. And then you write underneath what it is
Yeah.
you reject.
Okay. So that's just a basically rejection of that proposal to
Yes.
discontinue. Yeah. Yeah. So that's
Yes.
very helpful, Barbara, because I think we often I think our role often in advocacy, is to educate parents as far as what their rights are, and to sort of help them to understand what they should ask for, and to, also convey that the parents, know that this is, that they're entitled, to these services. And I think a lot of parents don't know that, and they find out that services are being discontinued and they feel like they're powerless to do anything about that. The other question, which, if I guess you should probably kind of finish the rest of the slides, but there are some questions that came up about 504 plans, and we sort of know that that's not the primary focus of the presentation today, but we were hoping that we could sort of talk a little bit about that too, just because that's such a common thing that pediatricians are a little bit more responsible for, than IEPs in
Yep,
terms of, making recommendations for that. Yeah. Yeah.
sure. Yeah, so I'll finish this quickly. Mediation is something you can you request to the Department of Elementary and Secondary Ed, and they will literally send a mediator to an IEP meeting and try to help the parents and the school meet at the same place. So, if they're saying we're only giving 3 hours of reading and the parents feel it should be 6 hours, they'll try to meet in the middle. They don't decide anything, it's just asking questions and encouraging people to talk. And there's a list of advocacy resources that we often give to our parents that are no charge. So those have been very helpful, sometimes providing legal advice or attorneys or anything like that. And so that is that. And I am happy to also talk about 504s.
Yeah, that's great. Thank you so much, Barbara. So there aren't any other questions that have come in yet that we haven't covered. So maybe actually there is one more question about the slide that you had for advocacy, and particularly the
Okay,
one for free services. I'm not sure. Yeah.
that one.
I don't see it, but
Oh, it's not
you.
sharing. Okay.
And then if we could, there's still that question about 504 plans, and someone is referring to a so-called district curriculum accommodation plan, and wanting to know, what that's all about. It's DCAP.
Yep. Is it sharing now?
Yes.
Okay.
And I think that's the slide that was asked for, because these are the organizations that provide advocacy for kids, that wouldn't require, people having a lot of money to pay. Yeah.
Yes.
Okay. All right. Yeah. So 504 plans. What are some words of wisdom you about that for us?
504 plans are sometimes much easier to get because a 504 plan, the easy way to think about it is the student has a disability, but it's not affecting their ability to access the curriculum. So it's completely accommodations that are offered. There's no modifying the curriculum. So, and there's also no services given with a 504. It's just the accommodations. And a lot of stuff I see listed on 504s are extended testing time, whether it's 50% extra time, double the time. Um, there could be things listed for executive functioning, like check in with a teacher the last few minutes of the class, or take a picture of your homework with your phone before you leave. Have a set of, like, if they're using a textbook for biology, have a copy at home in case they don't remember to bring it. It can talk about preferential seating and preferred grouping if a kid with ADHD, maybe they do better if they're sat in a group with some slightly quieter kids. So the 504 talks about that. 504s can also go to college with kids, which IEPs cannot, which is, I think, important for parents to know. Often, if a kid's on an IEP, we ask their senior year for it to be switched over to a 504 so that it can go to college with them. I don't know if there's questions about 504s in
Um,
specifically.
no, other than just speaking to that district curriculum accommodation
The
plan,
DCAP.
and I guess, yeah, yeah, and in general, it might be something that we would want to devote like a whole session to, as far as, sort of the 504 plans, for the different common psychiatric, conditions, because they're always linked, to a specific, sort of medical or, psychiatric, kind of diagnosis, as far as I understand. And so it's, I think a lot of times pediatric primary care folks, sort of need a little bit of content from us in terms of knowing, what to ask for. Sometimes parents, tell us what they want. We write it down, but there's, some best practices that we could learn, as far as, what kinds of accommodations, are useful for kids who don't qualify for IEPs. Yeah.
Yeah, definitely. Because there's a lot that can go into a 504, and it can really be almost anything anybody can think of.
Yeah. Yeah. So I don't know. I mean, we can sort of do our own background on this, but if you have any kind of recommendations of speakers, sort of who can help us with this, you can sort of be in touch. We can be in touch afterwards.
Okay,
Um,
perfect.
yeah, there's another question that just came in. It says, I had an evaluation team leader tell me yesterday that the patient I was calling about could not be reevaluated for an IEP for 18 months after the last eval where they did not qualify. Is 12 months the standard? Also, I thought that if a child had a new diagnosis, that it can qualify for them for reevaluation.
So yes, 12 months is this 12 months is the minimum that you have to wait to reevaluate because of the rules of the standardized testing. But they are allowed to do it right at the 12-month mark. They don't have to wait the 18 months. So that school, well, may have been misinformed.
Yeah.
Um, and new diagnoses, they have to meet about it and see if they qualify, but they don't have to redo all the testing. So if a kiddo is diagnosed with ADHD and qualifies and he has his IEP, and then he gets diagnosed with anxiety or trauma, they don't redo all the testing. They just bring okay, what supports can we put in to address the anxiety as well? So it's added, like the primary disability would be ADHD, the secondary disability would be anxiety, there could be a third disability, and it's just kind of listed in the order of which they're diagnosed.
Okay, that's really good. Another question. So this is great. We have some really nice questions here. And this is not uncommon. So in this instance, a family or the parent has not signed the IEP, particularly because they don't feel like it has an adequate, kind of, sort of adequate services that they want. The services are recommended, but they want more. And I guess the question is, would it be possible for the parent to to partially accept an IEP,
Yes.
and is there recourse if the school does not provide the partial IEP? Yeah.
Yes. So um, they could write something like, I accept the services listed. However, I reject the lack of XYZ services. So like they can accept what's on there, but also put down that they reject that there's not more on there. They have to like do that and then sign for the services to start. And if the school does not do the services that they did sign for, yes, they would have to give compensatory hours. The parents could make a complaint with the state, because that would be breaking special ed law.
Okay, that's great. And this is my question. So this strategy of complaining, to the state, can you give us any more details as far as, what parents can do if they feel like their rights, sort of under, the special education law, are not really being fulfilled? And particularly, the ones that we are concerned about are the parents that don't have, a lot of money to
Right.
hire, attorneys and private, advocates and stuff like that. And so what are the kind of specific steps, that we can educate parents to pursue, when they don't have the resources to hire their own attorney?
So there's two forms. There's mediation and there's a hearing. Mediation is more like help. It's not legally binding. It's just trying to find a middle ground. A hearing is legally binding with what's come up and it can't be disputed. I would never recommend a parent go to a hearing without legal advice. Some of those centers, like Map for Kids and that were posted, offer pro bono lawyers that will work with the families if it's decided it should go to a hearing at DESE.
Okay, great. And
Barry,
I
I
think
don't think, Barry, sorry, John, I don't think we answered the question about that other kind of,
the
Oh,
decap.
a DCAP.
yeah, yeah.
Yeah,
Um,
yeah.
so a DCAP is not legally accountable for anything. A lot of schools will use it when a kiddo doesn't qualify for special ed and doesn't have a disability that would fall under the 504 disabilities, but are struggling, and the schools just want to provide them extra supports. So while it's not legally binding in any way, it does help some kids with the need for extra time or things like that.
Mm,
I can share about my kid. He had some anxiety. He was in honors math. If he left the room, he couldn't redo his test. So they put him on a decap that he could step out and take a few minutes to take a deep breath and go back in and finish his test and not fail it because he
mm,
needed just a moment.
mm. Okay, well, that's a really good example. So Barbara, in the last minute, there is one outstanding question about, when parents are divorced, and presumably, we're talking about parents who have joint custody. What happens when the two parents don't agree on, sort of whether or not to accept or reject, the IEP plan?
That's hard if it's split joint legal custody, which I assume is what's being asked about if they both share
Yeah.
legal. So only one parent has to sign off on anything, even if
Mm,
both parents have joint custody. At the same token, only one parent needs to reject everything.
mm.
So it's kind of not a great situation to be in.
Okay. All right, so we have to kind of just work with that.
Right,
We don't want to get into an endless loop. Um,
right.
but anyway, Barbara, we're just at the end of our time, and so I just wanted to thank you so much. This was a very, very useful, informative presentation, and I want to thank all the audience members for all the great questions that have been asked, and I think we will actually plan another session at some point to really focus on 504s, just as another area to learn about. But thanks again, and thanks everybody, and I hope everyone has a good rest of your day. And we'll see you next month.
Thank you.
Okay.